Well, welcome back. It is what so many women and men dread when they look down at their legs, the faint blue lines known as spider veins and varicose veins. Joining us this morning is Dr. Taylor Smith, a vascular surgeon with VeinSolutions, to explain what you can do to get rid of those nasty little lines. Good morning.
Morning.
Lovely to have you in the studio.
Thank you.
Let's talk about some of the medical science stuff first. What's the difference actually between spider veins and varicose veins, and is there a way to avoid getting them at all?
So the difference is sort of arbitrary. Spider veins are much smaller, sort of thread-like veins that are just underneath the skin. Sometimes they'll have a reddish or bluish color to them. They can come about as we get older. Varicose veins are generally a little bit bigger, 3 or 4 millimeters in size, so about the size of a pencil lead or bigger. And those are sometimes connected to the deeper veins underneath the leg. They have problems bringing blood flow back from the feet back to the heart. So those are veins that we can treat and get rid of, and our body will naturally work around them to find other places for blood flow to go. The veins occur as we get older. So folks over 50, it's common for that to happen. Unfortunately, there's not much we can do to prevent getting the varicose veins. It's often hereditary, so if your parents have them, then you have a higher risk of having them. If you have a job where you're on your feet all the time, you also have a higher risk of getting the varicose veins.
Okay, all right, Mom, by the way, I'm looking at you. I think we have them running in our family as well. But how do we treat them? So if there's not really a way to avoid getting them in the first place, what can we do when we start to see them pop up? And are treatments covered by insurance?
So, second question first, some treatments are covered by insurance. The treatments for varicose veins, if you're having a problem with leg swelling and significant pain, those are most often covered by insurance. The sclerotherapy for the spider veins, oftentimes that's cosmetic. Sometimes it's covered by insurance, sometimes it's not. Really, it depends largely on the symptoms the patients are having and how it's impacting their day-to-day life.
Okay, all right, interesting. And speaking of the treatment, I know that you guys have modern science is pretty incredible. What is the actual way that you go in and treat those? So
the spider veins are treated by injecting a special type of solution directly into the vein. It irritates the inside of the veins. They sort of scar down closed and go away, and then they're not seen anymore. It can take several treatments to treat all of the veins that somebody might have. The larger varicose veins can be treated from within inside the vein with a laser or a catheter that heats the inside of the vein, that again irritates the inside of the vein and makes the vein close down, and so the blood flow is directed through the more normal veins, and the appearance of these varicose veins goes away. Oh
wow, okay, that's incredible that that's the way you can get these things to not look so colored on your skin. And I know that this is a bit of an odd question maybe, but there is a better time of the year, right, to treat things like this, and a less great time of the year.
Yeah, definitely. So compression socks are sort of the mainstay of therapy with varicose veins and spider veins. And so as we get into the cooler months, it's much more tolerable to wear the compression socks during the day when you're up and about. Also, sclerotherapy in the first couple of days or weeks after treatment can leave a little red mark or sometimes a little brown mark in that area. So it's best to have those treatments done when you're wearing long pants or things like that, so that the skin has time to heal and you can get the full benefit of it before you're out running around.
If you complain about being cold in your office, I think that this is the best time of the year to get it done right when it starts to get a little cooler outside, because you're going to have those compression socks on underneath helping to warm you up. Okay, I wanted to ask one more question. You know, when patients come to you and they've seen the things that have been on their legs, the things that have been bothering them in the mirror go away, what is sort of, the emotion that you get when they say thank you, for helping me look better?
Well, it makes you feel great. It sort of makes you realize all the effort and work you've put into being in this profession. It sort of pays off. It's wonderful to help people feel better about themselves, whether that's looking better or feeling better. So that's a big reward and a big part of it.
And helping with a little bit of pain too. So Dr. Smith, we really appreciate it this morning. Thank you so much for being here. Yeah. For more information or to schedule a screening, check out VeinSolutionsAustin.com, or you can give them a call. It's 512-452-VEIN.